Bom dia, boa tarde, boa noite, pessoal. Então, meu nome é Luiz Fernando, eu sou acadêmico do curso de Medicina da Universidade Federal do Pampa. E, então, bem-vindos ao nosso episódio inaugural do Physiocast, então, ao qual eu sou um dos hosts. E, então, apresento a vocês essa equipe incrível aqui que está conosco. Então, primeiro, a professora Bruna.
Olá, pessoal! Então, sou a professora Bruna, professora de Fisiologia Humana do curso de Medicina da Universidade Federal do Pampa, Unipampa, e sou a coordenadora desse projeto de extensão. Estou super animada por a gente ter esse projeto e por poder compartilhar muitas histórias e muitos insights com vocês.
Olá a todos que estão acompanhando esse projeto de extensão da Unipampa. Me chamo Rafael Fernandes, sou fisioterapeuta e atualmente pós-doutorando do Programa de Saúde da Criança e do Adolescente, da URGS, e sou um colaborador externo do Physiocast.
Olá, eu sou o Lucas Pereira, também sou acadêmico de Medicina da Unipampa, e vai ser um prazer participar hoje dessa conversa. E além de mim e do Luiz aqui, temos mais dois alunos, que é o Thiago Vasquez e a Ellen, que hoje vão estar trabalhando no backstage, organizando toda a nossa conversa, né?
Bem, hoje, dia 17 de julho de 2024, temos o prazer de dar as boas-vindas ao Dr. Ruhul Abid, um distinto médico que cursou medicina no seu país de origem, Bangladesh, com doutorado em biologia molecular e bioquímica realizados no Japão, e fellowship em biologia vascular e medicina na Harvard Medical School. O Dr. Abid atua como professor associado na Brown University, localizada no estado Rhode Island, nos Estados Unidos, e é pesquisador no Centro de Pesquisa Cardiovascular, no Rhode Island Hospital. Sua experiência abrange áreas como biologia vascular, doenças cardiovasculares e saúde global. Além de suas realizações acadêmicas, o Dr. Abid é o presidente e fundador da essa, Saúde e Educação para Todos, uma organização sem fins lucrativos dedicada a fornecer serviços de saúde gratuitos a trabalhadores vulneráveis de Bangladesh e de refugiados de Mianmar, um país vizinho a Bangladesh. Os seus esforços compassivos não passaram despercebidos e, em reconhecimento ao seu trabalho impactante, o Dr. Abid ele foi nomeado para o Prêmio Nobel da Paz de 2020.
So, today we are thrilled to welcome Dr. Ruhul Abid, a distinguished physician scientist with PhD in molecular biology and biochemistry, Japan, and fellowship in vascular biology and medicine at Harvard Medical School, with a rich academic background. Dr. Abid serves as an associate professor at Brown University and is the principal investigator at the Cardiovascular Research Center at Rhode Island Hospital. His expertise spans across fields such as vascular biology, cardiovascular disease, and global health. Behind his academic achievements, Dr. Abid is the president and founder of essa, Health and Education for All, a non-profit organization dedicated to providing free healthcare services to vulnerable workers from Bangladesh and refugees from Myanmar. In recognition of his impactful work, Dr. Abid was nominated for the 2020 Nobel Peace Prize. So, Dr. Abid, congratulations on the nomination and thank you so much for joining us today. I would like personally express my sincere gratitude for your presence here in Physiocast, for accepting my invitation. Your participation will bring a valuable enrichment perspective to our episode, and I am sure that our listeners greatly appreciate your contributions. So, thank you so much.
Thank you, and I think I really thank all of you, and I'm really, really glad to be here because I always love to work with young students and faculty members, so it's my pleasure to be here. Thank you.
Thank you, Dr. Abid. Lucas, so let's start.
So, Dr. Abid, thank you once again for joining us. It's such a great pleasure to speak with someone with so much experience and knowledge at such an early stage of my graduation. So to start our physiocast, we would like to know more about your life before college. Where were you born? Where do you come from?
Yeah, I actually was born in Dhaka, Bangladesh, long time ago, and then I grew up in Dhaka, which is the capital of Bangladesh. So Bangladesh is 180 million people, and it's a very small, densely populated country, which is the size of Iowa state or Georgia state in the United States. Just one state size is kind of entire Bangladesh, and 180 million people, which is half of US population living in one state. So it's one of the densely populated place. And Dhaka is also at this point, when I was growing up, it was not so crowded. Now is Dhaka is a 20 million people in Dhaka, the capital city. That's where I did my schooling, my primary school, different schools, but different regions of Dhaka. Then college, then medical school. Then I became a doctor from Dhaka Medical College, which is at that point it was the best medical school of that country, and it still is a very good hospital. It has more than 3,000 beds patients, so it's a huge hospital. So I worked there, and then after that, graduating from medical school, I went to a tea garden. It's called tea producing company in northeastern part of Bangladesh near Indian border. There I worked for almost 3 years, and there I provided care to, just as a young physician, to the people of laborers, workers of tea garden. That's my brief introduction in Bangladesh.
Dr. Abid, I would like to know what inspired you to pursue the medical career. Like you said, you graduated in Dhaka Med School, and I would like to know a little bit better how, when it comes, what inspired you, what were your motivations in that time?
My motivation is to go to medical school. Yes, that's a very good important, because it has some very emotional history with it. Because I was growing up, I was very good at math and physics, so always those things attracted me more. So I was thinking, because my father was in applied physics field, so I thought maybe I'll be going to applied physics, because physics always kind of fascinated me, and math also I always enjoyed. So I was thinking that I will go to physics and all those kind of. But when I was in, I think when I was 6th grade or 7th grade, my grandmother started living with us. She came from the village. My father's mother used to live with us, and that point she had asthma, bronchial asthma. So that time asthma was not like this. Like now you can take some medicines or some inhaler and it's controlled. You never see like people are suffering so much. That time it was like, when we were growing up, it was like, it can be very severe. It's called status asthmaticus. Like you have asthma attack and you cannot cure it with anything. There is no inhaler. So they used to take, you need to find a doctor. They will bring a large, big ampoule, 20 milliliter, and they will inject that slowly. And then if it's at night, the hospitals are not so developed at that point. Long term, when I was growing up, there is no emergency ambulance, anything. So my grandmother used to have that asthma attack, and I used to run. Like if it's at 1 p.m., at 1 a.m. at night, my parents will come because they are attending my grandmother, and they will tell me, I'm a 7th grader that time, 12 years old. I have to run outside the house, go to a doctor's house, knock one doctor. The doctor's wife would tell, no, he is not available, he cannot go. I'll go to another doctor's house and knock. So then the doctor will come, give me the box. I'll carry the box, the doctor's medicine and all those. Doctor will come with me in middle night, and I would feel very grateful to the doctor that he's coming to treat my grandmother. Then they will come, and my grandmother was like almost breathless, very severe. She is almost like a blue color, which is called cyanosis. You guys know about it. So then cyanosed, and she's sitting like pushing her hand on the bed. It was like anytime she could die. So, and then doctor will inject something with a butterfly needle. It's a large ampoule, and doctor would ask me, come here, with a very affectionate doctor, come and hold this ampoule, and can you press it in such a way that the entire medicine can go in 20 minutes. So 20 ml, 20 minutes, very nicely. So I used to do that, and I would see that after 5 minutes, my grandmother is becoming normal. She could breathe, and that actually had a great impact on my persona, on my feelings, everything. Oh, this is a magic. You can save one's life. And that's why that motivated me. At that point, I promised to myself that I would like to become a doctor. I would do something good for the humanity. Otherwise, I would become an applied. Still, I would read a lot of physics, black hole, Stephen Hawking, and all those scientists. Yeah.
That's such an inspiring story. And as you said, I think Bangladesh reality is a lot different than ours. So could you tell us a little bit more about your trajectory in college in Bangladesh? How is it like?
Yeah, that's another reality. That's the ground reality. Like Brazil is a big country, right? It's a huge big country. I had the opportunity to visit it, and I really love this country. It's so beautiful, so rich. I had been to Porto Alegre, to São Paulo, and other places, but I really love it. It's a huge country. But population-wise, maybe still not so populated. But in Bangladesh, when I was growing up, it's now 180 million. At that point, it was almost like 75 to 80 million at that point. But it's still like a lot of people. So we had only 9 medical schools. So you have a very competitive schooling system. That time it was not so much private schools, it was all government schools. It was like a magnet system. You have to apply to a school, good school, then they will have an admission test in 6th grade, 3rd grade. If you do good, you go to the good school. If you don't do good, you go to the other school. But there is no way that money can buy something. That was just merit at that point. Then only 9 medical schools, and you can think of like 80 million people. So every year, students like 200, 300, 500,000 students are graduating, and they will all apply to, because everybody wants to become a doctor or engineer or some kind of other professions. So total medical school had 159 medical schools, around 1,000 to 1,100 total per year seats for medicine. And then you have we had 80 million people. It was very competitive, very competitive. So you have to be really good in studies. And, so we all had to work very hard. And that's how I went to the medical school. Once I went to the medical school, then I worked also hard. But at that point, I got involved with other extracurricular activities. Like if there was a flood, I used to go there to supply some food to the flood-affected area. We had one very good organization called Shamdhani. Some students formed it, blood donation. That was the first blood donation, blood bank in Bangladesh. That medical school from our medical school actually did. I didn't do that active role there in blood bank. I was more kind of donating blood there, but I used to take participations in flood affected area and other places where people need some help during medical school. So that was my medical school days. And I was also involved in cultural activities like drama, singing. I used to do annual drama participations and all those. No, it's studies not like all like studies and all this. A lot of other things.
Dr. Abid, something you said really caught my attention when you told us about that history, that you had to knock door in door just to find a doctor to help your grandmother. And that made me think nowadays, what are the problems that, for example, Bangladesh, which is an developing country, face? I would like to know that from you.
So now it's very much changed the situation. Now it's like 80 million to 180 million people. The country size is same, but the economy developed a lot because there is garment industries, there is people going abroad, sending wage earner, and there is a medicine industry, pharmaceutical, which has a license to send medicines to European countries, even to the US. There are a few companies sending medicines here. So Bangladesh is now like almost $500 billion economy. So it's changed a bit. And then a lot of hospitals, private clinics, and government hospitals. And the rural healthcare system is very developed now, like there are village clinics. So that's why Bangladesh managed the COVID-19 crisis much better compared to its neighboring countries. So it has a very good rural healthcare system. But still, like for tertiary healthcare, it's in Dhaka, there are big hospitals, which are comparable hospitals, good. But in Dhaka, you have to remember that almost 36% people are in Dhaka. 20 million people, 36% living in kind of slum areas. So they don't have healthcare. because they are coming from the villages. Village has good health system, but when they are displaced from village for in search of job and other things, they come to Dhaka, the capital, big city. They used to live in slum, but they don't. In Dhaka, we don't have that kind of healthcare system which can support the poor people. So it's mostly like poor people go to Dhaka Medical College and then it's overburdened. There are people living on the floor and all those kind of things. But if you have money, you get good treatment. So it's changed a little bit. A lot of systems changed. A lot of things improved. Like child mortality rate, when I was growing up, it was infant mortality was 140 per 100,000. So it was high, 140. Now it's like 70 or 60 or 50, even less than neighboring country, India and Pakistan. So it improved healthcare. Longevity is like 70. My time it was like 60 years or 59 years longevity, life expectancy. Now it's 75 or something like that. So per capita income is higher than neighboring countries, Pakistan and India, all those. So it improved a lot from that time.
And Dr. Abid, it's not an easy path from Bangladesh all the way to Harvard University, to Brown University. So how did you end up in the US? What was the process?
Yeah, so the process was when I was in Bangladesh, at a medical college, I graduated, and I got married like at the end of my final year. So it was kind of a pressure to be independent soon, because I was living with my parents since I got married. So I have to support my family. So my goal was to be on my own. So after medical graduation, I didn't wait for any job in Dhaka or government service. You have to wait. I got the British company job in Tea Garden. So I went there. So I worked, as I mentioned, I worked there 3 years. They gave me nice bungalow, they gave me car and all kind of facilities. But I saw that I was working for the laborers, Tea Garden laborers. They had nothing. They had very little because their sons are becoming workers. Their children are becoming workers. It's kind of a bonded labor system British introduced, and that's still there. So I had to help them a lot. So that I planned like I'll be there for 6 months, but when I was working for those people, I developed some health card system. I trained their community workers. It was in early 90s. So I trained the women to go to house and convince people to antenatal checkup for blood pressure, blood glucose, that kind of things, and immunization in that place. So in 10 months, the British company, because they love that kind of work, so they made me group medical officer, chief medical officer, when I was only 28 years old. So I was in 10 gardens charge. So a lot of activities, lot of improvement. I did sanitation and all those kind of things. So I was very happy. And I didn't understand when 3 years already passed there. So I enjoyed that. It made a lot of changes there. A lot of people's life changes. I'll not go into detail, but then the company was awarding me a lot. But then I thought, what will happen if I live in this remote place for long term? I'll get detached with the medicine advancement and all those kind of things. So I thought maybe this is time I go for higher studies. And then at first I thought I'll go for public health studies, but that didn't work out that well. So I went to molecular biology and genetics to understand the like a basic mechanism of disease process and how you can discover the medicine and all that. So I went to Japan, and my first child was born. So the second child was also born. So there actually I did the PhD in molecular biology, and then I was thinking, what next? If I let my children grow there, so they will learn Japanese, not very international. So, and I cannot afford English school as a young faculty. So I thought maybe I'll then move to US. And then US is the science and other things so much well developed. So I came to US for that reason. And then I did fellowship, cardiovascular medicine, and went to Harvard and then did there. So then I became a faculty there. Because the main thing I would like to say that the main thing helped me is wherever I went, because you can see my life was not planned. Like now you can plan life, you have internet. Like when I was in Bangladesh, I was applying for, after tea garden work, I was applying for scholarship to Japan, Japanese government scholarship. I didn't have any internet. So we had to write letter and send 1 month to go, 1 month later to get the response. And the professor would write to me, can you write an abstract, what you want to like to do? So I have to read professor's paper. There was no PubMed, no internet. It's pre-internet period, so you can think. So I went to ICD. There was an American hospital, diarrheal hospital. So they have a telex system. So I would give them, these are the papers abstract I want, because my professor sent me some papers name from Japan. I would go there. They will give me come after 2 weeks. I'll go 2 weeks later, and they will give me 10 abstract. So 10 abstract means 10 roll of paper, big papers. I have to carry that home. So then come home and then read that and write something from there, send a letter to the professor by typewriting in English. Then they will come back, and I got the scholarship. Then I went. So it was a very kind of a different process. It was not that easy, but one thing was there. I didn't plan my life that after Japan I'll come to USA, then Harvard, then Brown. No, I didn't plan that. It happened, but main thing, why it happened, if you ask me, because I am pretty old now, so I can go back and reflect on my life, that wherever I went, my main thing was to improve the situation there, people's lives. I went to Tea Garden. I had a nice bungalow. They had 14 servants. The British people had that system there. So you don't have to cook. My wife didn't have to cook. Everything, your bathtub is ready when you are going for shower. It's like fancy system. You have the car there. So you have a driver. But my main goal was to improve the people's life there. Nobody told me that you have to do that. If I was in the clinic just writing the prescription for the sick people, that's fine. Nobody told me to go to the community, do the bleaching powder or chlorine to the drinking water, because they have the well. They don't have any tap water. Then do immunization to save people. And then immunization, they will not take vaccine from the government people, because they have a different language in Tea Garden. The people are different ethnic group. They were British did these things. Actually, they brought people from India to Bangladesh and did the Tea Garden setup. From Bangladesh to India, Tea Garden setup. So they cannot mix with surrounding people. That's why the bonded labor is so effective there. So, but my goal was to improve their life, thousands of people's lives improvement, pregnant women, children. So that was my gratification from there, satisfaction. And then I went to Japan. There also I wanted to, and I was always like mixed with people, not only study. I went to play tennis, because I picked up tennis in Tea Garden, the British company. When I went to Japan, they were surprised. Oh, you can play. You came from a poor country, developing. Bangladesh was not like this that time. It was very poor. Came from there and you can play tennis. They were surprised. So I was included in their society and all those kind of. So that's how, like, one thing is to do good wherever we are there. We don't have to think, oh, I'll go to Harvard and then I'll do good. No, I'll do good today for myself, for the people around me, and for the situation here. If something is bad, some machine is not working, try to improve that. Some wall is falling, try to repair that. Whatever. Some people's lives improve. That's the main thing. And another thing is talk to people, be friendly to people, and have a genuine heart for people. That's important. I saw like people who have genuinely good in their heart, they do good wherever they go. It doesn't matter.
Dr. Abid, I've known you for like 30 minutes, and I notice, I think, two things that are really important, I guess. It's how you said, for us, I'm going to be a physician. I need to be empathetic. I need to be humanitarian. And we've done a lot of research on you, of course, to do this podcast. And we read a lot about HEFA, Health and Education for All. And we would like to know how has this project influenced your life as a physician? Because for me, it really is something that is very noble, because you help a lot of people that are not in the best condition, and for me that's very noble of you. So if you could speak a little bit more about HEFA, I would like to hear.
Thank you. That's very close to my heart, the topic. It's a health and education for all, or in brief, it's HEFA. So actually, when I left Tea Garden, that after 3 years of work, went for Dhaka to then applied for scholarship in Japanese government, went there to do molecular biology PhD and research, and then came to USA, struggled to set up life, fellowship, become faculty, tried for a green card because visa is continuous problem. So if we get a green card, all those kind of things. So by the time, and in the meantime, I went back a few times to Bangladesh, and my father passed away. So I went there, and I saw the 10 years passed, like when I came to the USA, before I understand that 10 years is gone. So then I thought, okay, so then that time I was a junior faculty at Harvard. At first I was instructor in medicine. In 2008 I was assistant professor. So I thought that this is time something to do. I had grant, I have some small research opportunities. I was teaching at Harvard Medical School, first year, second year medical school students. So that time I thought that, okay, this is some time to do for my country. I was thinking, but I never acted on it. Many people keep on thinking, but I'm a kind of a person who, if I think something a lot, I have to do it. Otherwise, I feel kind of unhappy inside. I cannot do work. So I was thinking a lot, but Harvard is, as you can understand, it's a lot of pressure work, a lot of pressure for research. I had to train other people. I had to teach. I had to do a lot of, to be on the competitive. And as an immigrant, not native, you have to be like 2 times more hardworking, or at least 2 times, maybe 10 times is better. So so I have to do that. So in the meantime, I saw a faculty. I came because there also I tried to develop the young faculties, postdocs life improve. So I quickly become part of a faculty development program, like how to write a grant, how to write a paper. I used to teach that at Harvard with other faculty members. And that made me kind of in the limelight. People started liking me a lot. So that, oh, this guy actually helped. I used to do journal club arrangement, like your professor, Dr. Runa Lima is doing. It's kind of same kind of thing, that improvement of other faculty, other students. So there, when I was doing that, I met a person whose name is Dr. Rosemary Duda. He actually helped me co-found Haifa. She used to go to Africa a lot, and used to take old things from operation room and go there. I asked her, what do you do? She said, oh, there are people needs. So she was a surgeon, and she also had MPH, so oncology, surgical oncologist. So she used to do breast cancer surgery and others. So she used to go there, and she told me that she goes there and then to do a lot of work. So I said, oh, so she said, you are from Bangladesh. She was senior to me. She said she actually did some work in Bangladesh 30 years ago. For 3 months as a resident. She went with a missionary hospital, remote place, and helped. She said, if there is an opportunity, I would like to go back to Bangladesh. So I said, yeah, I'm thinking of doing something for Bangladesh. That's how we started. And then we formed an organization, Health and Education for All, got registered and tax exempt in the USA as a not-for-profit. And then I never worked on that until 2012. Then 2013, the Rana Plaza, the garment factory, collapse. I don't know if you know about this. 2013, if you search, you will see that more than 1,000 garment factory workers died in one day because of a building collapse. And that building had a big crack. But garment factory workers, there are 4 million garment factory workers in Bangladesh. That's the highest. Like Bangladesh earns $50 billion by exporting garment. It's the second largest garment factory. We will see made in Bangladesh, a lot of shirt, pants everywhere. So because after China, Bangladesh is the second. So that garment factory workers died. They had a building crack, but they couldn't come out of the building because the owners told them, you have to work because there is a shipment deadline pressure and all those. And that crack actually collapsed the building. So I thought, if the workers cannot come out of the building, there is a huge crack, risk of building collapse, and they die. If they have some hypertension, diabetes, some disease, tuberculosis, they cannot go to a doctor. So let's focus that part. Because I was thinking of tea garden, but okay, let's focus that. And then one summer in 2013, since I live in Boston, so I asked some Harvard MIT students. They said, okay, we'll volunteer with you. And then Rosemary Duda, the professor, she went. My daughter, she was in 9th grade at that time. She came with me. We went to Bangladesh, and Dhaka Medical College recruited some volunteer from intern doctor. That's how we started that thing, that garment factories. We went there, helped them, then learned there about them. And that time we developed some, wherever I do, one thing is very important to me. My desk and other places are so disorganized, but whenever I work, it's very organized way I work. So I had that 1-page paper, then 3-page, then a booklet. Everything we did, every person, we wrote everything there, systematic. But it took us 2 weeks to do 300 workers. Then I thought it's not feasible. 2015 also I did 2,200. More students and doctors go with me for 2 weeks. We help them screen hypertension, diabetes, and then do that treatment. But by the time we analyzed the data, the 3 months passed. I came back, those are lost. So what we did, I thought that I have to devise an electronic health record system. That's what I did. A small health record system, very user-friendly. Before that, I went to Harvard Medical, I went to Nigerian doctors, I went to Bangladesh, many places. They said that, but there was nothing. So I developed that with the help of a software friend here, who was also a graduate from Brown. So then we developed a handheld tab. We can go anywhere without internet. You can do that, and they have a flagging system. It has ICD-10 coding. If you know about diagnosis, they have ICD-10 coding system. So that kind of a drug interaction, if someone is pregnant, if you give some drug, it's harmful for them, it will interact and show a red flag. So it's very developed system, but very user-friendly. Without internet, it can work. And later, when we have that 2017 Rohingya crisis, Rohingya refugee, Myanmar persecuted 1.1 million people, came to Bangladesh. So that point, I already had that healthcare system, electronic. So we took that there, but there was no electricity. Then we devised a solar panel charging battery. If you go our on-site, online, you will see that health and education, but there are some pictures. That solar panel could charge battery, and that battery charged our laptop, works as a server, Wi-Fi router. That connects the handheld tabs, like Android tab. It's like a cell phone kind of things. They connected all those. Though there is no electricity, there is no internet. And then when they have internet, they connect later, come to the city and connect that after every week once. So that's how we started that health and education for all. So that good things in the field in Tea Garden, what I did 3 years, that gave me confidence that you can build anything from zero. You train the people, use local resource, and develop. And any issue it comes, don't bring with the problem. Bring the problems and get a solution from there. Always. So even if you go to your boss, your mentor, these are the 5 problems. Think of one solution. That may be correct, that may be not. Maybe your mentor, your boss will come up with another solution, but take a solution. These are the 5 problems, but this is one solution. So that's how I think I developed this health and education. One is like your insight that to do good for people. Another is whatever resources we have, you can utilize, and you can use that to improve that local and contextualize. Because I have been in the US for last maybe 25, 26 years or more. But whenever I plan something for Rohingya refugee camps, it's their context. In COVID-19, we did a lot of COVID-19 clinical management course, because from Brown, I had the opportunity to help 85 countries, 100,000 people. Brown did help with the clinical management in April and May in 2020. Just COVID-19 hit and we did that. We contextualized that same program for Bangladesh. Whatever they had there, just we don't have the fancy things, so we contextualize that. I think so. That's how the health and education for all is so successful, because we contextualize and train our people, whoever is volunteering, or we have now 149 or more employees, doctor, nurse, we have our own IT team, but everyone deal with respect. It doesn't matter whether you're junior or senior or your subordinate, deal with respect, encourage the good work, and appreciate that. Those are the things actually made the HIFA program so successful.
And Dr. Abid, I think I speak for all of us med students when we say our dream is to help those in need too. I think it's the major goal, our major goal in college. So is it possible for us as students take part in such projects, humanitarian projects?
Yes, I should say definitely. I didn't have that opportunity when I was a student, other than flood affected victims helping and all those, but no systematic. But now I work at Harvard, now at Brown. So even Harvard students come and they go for someone from School of Design. It's not has to be medicine. So your question is medical students, definitely, because you can go, because I have medical students, a lot of medical students go and work there. So it's not that to help them. It's mostly when you go to the field and see that situation, a lot of ideas come to your mind. You become more humanitarian, you become more grateful, you become more humble, to yourself. That's very important. And you get some mental peace to help them. That's because everyone has a lot of issues in their own life, right? As you grow, there are so many issues. But if you help other people, that's the most gratification you will get at the end of your life, during your life, and at the end of life also, I think, because that's the most powerful thing, to help other people, and become grateful. If someone helps you something, write a recommendation letter, did some help, slightest thing, get the job, call them first, email them first, tell them I'm so grateful to you. So that makes you a better person. So I think as a medical student, my medical students here, they come to cardiovascular, do research. Some go to, even some don't go there, but they analyze the data. Someone works with the newsletter. We have monthly newsletter. They help contact with the people in Bangladesh, the doctor, nurse. They get the news, they publish that here, help Haifa publish newsletter. Someone applies for a scholarship, and I'm also part of the global health initiative here. I'm the program chair for the grand rounds, so we do a lot of work there. So a lot of students do interactive work, not only Bangladesh, Kenya, Nigeria, Philippines, wherever Brown University works, they do that. So I think you should also have, not through your university is best, do that. If not, contact other organizations, do at least one kind of global health work. And during your medical school, if you have the opportunity, visit one other place where resource limited, you do something. Go to good places, definitely go. Like I have now 5 medical students from Saudi Arabia, Riyadh. They came actually to do, every year they come, last 12 years, doing summer internship. I have from Puerto Rico, I have Costa Rica, a lot of places they come and do that summer stuff. Do that, go to developed places. Also do some kind of a resource limited place. Even if it's in Brazil, some place you need slum or somewhere, you go and help. That will give you some perspective. This is very important.
Actually, I think our university gives us the opportunity to be humanitarian. Like in May, actually here in our state, in the south of Brazil, we had an awful disaster. We had a flood here, and it killed several people, and everyone was like very desperate. Everyone was losing their homes, losing their everything. Basically, everything was lost. And one of the things that our university was doing was helping them. So us as students, we are going to the streets, we are going to the people who are affected, and we were helping them. And I think that's really important, because it's how you said, we need to be humanitarian. We are physicians, we need to be empathetic, and we need to help our patients and help everyone. We need to be good persons, we need to be examples. And I think that summarizes a lot the physician role, I think.
Yes.
And I really I really would like to know, I'm very young. I'm just 19 years old, and I'm the beginning of my academic journey. And you are an experienced person, and I would like to know what were the biggest challenges you faced during your academic journey, because I think that may help me, I think, in the future.
Yeah, so I think that there are challenges in every aspect of life, in every aspect. So like when I was growing up, I was a student, and then 7th, 8th grade, and then 12th grade, when just before getting into medical school, there are personal setback. My parents got divorced, so that made a kind of, in that part of the world, at that society, it was a very kind of a, it's now maybe it's not so difficult. We hear a lot about it, but at that point it was a social stigma also in Bangladesh. So that was one challenge I faced when I was in medical school, because everybody had a nice family and everything I didn't have. So that was one thing. And then in final year, I got married. So that was another challenge to put to me, because life put that because that early establishment and all those. But those are good things. So everything challenge, it comes something good from there. Because if I were not got married in final year and all those, didn't have the pressure to quickly find a job after getting medical school, I wouldn't go to tea garden. I was comfortable in Dhaka, the capital. Why you go to like 300 miles far and then do a remote place? There is no people living there, no solid road. So you have a nice bungalow, but you have nothing outside. It's beautiful. I loved it. But from Dhaka perspective, so it's going from Sao Paulo to some other place, something like, or New York to some other place. So that was a challenge, that point. But why I did that, I could take a government job. I could become a big government shot now. But I would tell you that I'm happier than what I would have become. So any challenge is actually opens a new door. So those are the minor challenges. Then I went to Japan. I was very brave. I didn't know the language because I thought I'll go there and professor can speak English. They are US trained from NIH and all those, so it should be fine. But the conferences were in Japanese. Go outside Japanese. Went to language class, learn a new language. But any challenge, so now I know another new language. So you have to put yourself to a challenge and not to be afraid. So that I learned. Then I came to the US with visa. So no green card, nothing. And then language barrier, then cultural barrier, because Japan is everything is oral. If you say that I'll take your house after 3 months, you will go and get the house 3 months. You will wait, you will find the house, nothing will change. Anything honor, word of honor. So nothing is written there. And then I came to the US, everything is written. If you don't write, there is no contract. You may be bankrupt if you don't have anything written. So totally different culture. Another shock. I was signing the first apartment signing in the US and it was 22 pages. I said, I cannot read and some are so tiny. They said, no, you just sign it. So I said, no, I cannot sign. I have to bring home. I studied the whole thing whole night. Now I sign anything. So that's a shock. Then I came to Boston, the Harvard. It was very high paced. I was in Bangladesh, not educated here. In Japan, not educated here. So then in Harvard, the top of the top. All international people, all American, the best of the best, highly competitive. So I had to come in the morning. I had a family, 2 kids, small kids. My wife worked 2 jobs to support the family. I worked the postdoc from early morning till late night, went to go back, then got the son's education and all those homework, help with that. So it's a challenging life, but I always, any challenge, I face that. So there is no greater challenge for me. I think every step you have your own challenges. Whatever challenge, I think that will open a new door. If something doesn't work, something else will work. That's the attitude I have. So I think that helps succeed.
That's some amazing advice. Thank you. And we talked a lot about your humanitarian works about Haifa, but you're also really accomplished in scientific research, especially in the cardiovascular area. So could you tell us a little bit more about your researches?
Yeah. So my research is like to find out a new blood vessels formation or the existing blood vessels to keep them in the heart when there is ischemia. So when there is myocardial ischemia before heart attack, if we can have a situation where we can improve the blood vessel survival so they don't die even in ischemic condition. So if there is ischemic attack, they will proliferate or they will supply blood so they can survive. So what I did, like my greatest discovery, I would say, when I was at Harvard, that time I made it, and that's my career actually now. At that point, I found that people were doing antioxidant, a lot of antioxidant supplements. There was clinical trial antioxidants. So I found that antioxidant was killing endothelial cells in vitro in the plate. So from heart, human heart. Then I tested human lung. That's also killed by antioxidant. And then I got cow's pulmonary endothelial cells from that also was killed by antioxidant. I said, so why people are saying that antioxidant boost? Then I looked for a trial. I saw HOPE trial, ABC trial, clinical trial. They gave antioxidant, 1 gram of vitamin C or vitamin E, and that also failed. That trial didn't improve cardiovascular. You can find that trial there. 7,000 patients in many different countries. that failed after 10, 15 years. And then I studied that, I saw that there are more heart failure with some of the patients with that antioxidant, high dose antioxidant. Because antioxidants is everywhere, in lime, in oranges. If we take that, that's good, because that also helps build collagen, absorb iron. Those are like, so those are not antioxidant, vitamin C, but mild doses antioxidant. That's fine. But large dose is harmful. So that's why then I found out that, okay, so oxidant is important. I found that oxidant signaling is important. PI3 kinase, AKT, cell growth, cell survival in endothelial cells is very important, the oxidant level. And then why antioxidant was killing? It was global antioxidant. But if you have subcellular antioxidants like mitochondria targeted, which I work now, I have a transgenic animal model, I have nanoparticle, I have extracellular vesicles, and all other studies. We have a small animal, large animal, pig, transgenic mice, human, like bypass surgery samples we use here. We find that if we give mitochondrial antioxidant for a short period of time, low dose, that helps survive the blood vessels and endothelium. If we do long term, that kills. So I think that's made me like very, and always I see something when there is a challenge, like antioxidant people, that paper got rejected from 7 big journals. And that was my first paper as a fellow. So I was like so devastated. They said, oh, this is counterintuitive. Then we quickly published in Phelps letter, and that became the highest cited paper later, because that was the first finding that antioxidant is not always good. It's a subcellular oxidant.
Okay. Dr. Abid, I think we are almost, we lost the time here. We don't wanna like keep you, but we don't wanna, but we wanna, because the talk is so good. We are like so happy in talk. I have just two last one questions. So for you, what is the importance of research, do research, and be a physician? How the things can correlate, basically?
Yeah. So I think in the in most part, like either clinician or researcher, but in the US, since it's the #1 country for research, so all the clinicians, even the medical students, they have research background. If they don't have research background, they cannot become a good clinician here. So the undergrad student, you know that after 12th grade, they have 4 years of college. If they don't do research that time, medical school will not accept them. When they are medical school, like I have 2 medical students working with me at this point, they are first year, second year. They come every day, 2 hours, 3 hours. Sometimes they cannot come, but they come in weekend. They do some research. So research, and these are very important. And physicians become or do research is very important, because as a PhD, we can do research. That's for a fixed field. But if you have a collaborator physician with you, they have the disease process idea also, right? So that disease process, they understand much better than just a PhD. So, but PhD understand the molecular mechanism better. But that collaboration, that is very important. But if you are a physician scientist, that's very good. So, but always you have to collaborate with physician, scientists, but the joint is better. Like both together is better. That's how the society develops. That's how we make discovery, inventions. That's how medicine progresses. We have another question.
So I was with the turn off. So Dr. Abid, if you could like leave a piece of advice for students listening to you, what would it be?
I don't think I'm in a position to give advice. I think everybody has their own kind of thing. But in general, I would say very important is to be curious, to understand why it's happening, or at least have the question inside you. That's anything you are doing. If you're reading anatomy, if you're reading physiology, why is that? Why is the most important thing in life? And then you can find how and everything. So that question asking, curiosity is very important. Another thing, as I mentioned before, that very important is whatever you are doing. It can be serving as a waiter at the restaurant, part-time job as a student. Do that best. Study best. Whatever you do, try to do the best. If you invite some people at your house, do a nice presentation of the food and everything. So anything you do, try to be best of that, at least up to your limit. So that's very important, to try to do best and help other people. And another thing is very important, like people will like you, they will try to help you if you are grateful. Everybody loves grateful people. I know many people, like they get letter, they get scholarship, fellowship, but when they get it, they don't say anything. Later I come to know, oh, this person did. So we don't feel good, we don't help them later. Like you cannot, because I have 80, I write 80 recommendation letter every year. So I have to be very careful who I write and who I not, right? Because I cannot write recommendation letter. So I think that part is important, as I mentioned in my talk, that try to be grateful for any help anyone did. Your friend, your mentor, your neighbor, that gratefulness will make you happy, keep you happy, and will bring more and more good to you. Curious, help other people, yeah? Those are very important. And do good, whatever you are doing. It doesn't matter. As a PhD, as a medical student, as a doctor, as a singer, try to do good for others.
So thank you so much, Dr. Abid. I did some notes here. We don't have time, but one very, very important thought that I wrote here that was that you say, do good today. I will do good today. Not just wait for I will do after I finish the undergraduate, when I do my graduation, do good today. So I think this was like a very, very important thought that we received for you today. So thanks so much for this important thought. And so we really appreciate, Dr. Abid, the time that you dedicate and also the knowledge and share with us. And we hope you enjoyed the experience as much that we enjoy having you as a guest. So thank you so much. We probably, me and I speak for the guys, we can stay here speaking with you for more, 1, 2, 3 hours. We don't have this time. But
yeah, we can have another session later.
Okay. Yes, but thank you so much for sharing with us everything. A lot of beautiful phrase and everything. So thank you so much. I don't know if the guys want to speak something before we say bye.
I could say something.
We just like to say.
Can I start, Lucas?
Yeah.
I guess this life experience of Dr. Abid, in my opinion, give a good message for us that you guys that we live in Uruguaiana, that is a 7-8 hours city far from the capital. It's a place, all our region, Uruguaiana and the other cities, it's a place that we can do a lot. Because we are far from the capital, there is less money, but we have a federal university with good professors, good students there, and for sure can help people that live in our area. This it's an amazing message. Thank you, Dr. Abid.
Yeah, thank you. So I think this is great. I really enjoyed, and I always like to see the young people encouraging, because you guys will take it ahead, and maybe we'll have a different world that we lived in, maybe with more empathy for people around, right? Less violence, more empathy, more peace, and you have to work for it. You have to work for it, definitely. And yeah, start today. And you don't have to be like money or medicine or anything. Help someone on the street, anything. Help your poor neighbor.
Yeah, I would just like to say we are immensely grateful for you coming here, and it was amazing talking to you. I learned a lot, so just thank you. Thank you for taking our time to speak with us.
Thank you very much.
I would like to thank you too, Dr. Abid. It was such a pleasure to have you here. I think for us, especially my colleagues, Lucas, Ellen, Thiago, we heard valuable lessons here, and it was such a great time. And I think it really is amazing, because I'm in the beginning of my journey. I'm very young, and to have you here to talk with us, it wasn't so much time, but it really was a great time.
Thank you. Thank you very much. I wish you all the best. And I'm sure with this program, you will help a lot of people. Keep on doing the good work. You are already doing good.
Thank you so much, Dr. Abid. We'll see you in another opportunity.
Sure.
Okay. Bye-bye. Thank
Bye.
you.
Thank you. Bye.